Hello everyone, so in today's video we are going to be talking about asthma. As we know, asthma is an inflammatory disease. So what actually happened over here, that there is constriction of the bronchial smooth muscles, which eventually cause shortness of breath, cough, chest tightness, and wheezing sound, and rapid respiration. All of these are because of the vasoconstriction, which is led by the inflammatory process or inflammatory phenomena. Inflammatory phenomena is even worsened because of some cells or cellular elements such as mast cell and T lymphocyte, eosinophils, etc. All of these are called as inflammatory mediators because they actually worsen the condition of inflammatory phenomena in asthma. So in this video we are going to be discussing about the sympathomimetic drugs. So sympathomimetic drugs are actually one of the kind of those drugs which has actually bronchodilatory effect. So first of all, we are going to be discussing about sympathomimetic drugs which are having selective response or selective action on the bronchial smooth muscles. So we have selective beta agonist, and then we have non-selective beta agonist, which are being used for the treatment of asthma. So drugs which actions mimics that of sympathomimetic stimulations are called as sympathomimetic drugs, which we already know. So selective beta agonists are further divided into short acting and long acting. So short acting agents salbuterol, terbutaline, and long acting, these include salmeterol and femoterol and formoterol and terbutaline. All of these are having longer action. So as we know, when there is sympathetic stimulation, what actually happens that there is bronchodilation, because in sympathomimetic stimulation there is fight and flight response being going on in our body, and in that response we need more of the oxygen inside our lungs so that we can respirate more rapidly and more frequently. So for that purpose we need bronchodilation, so that there will be more surface area and there will be more absorption of or exchange of gases being happening over the alveoli. So in asthma there is bronchoconstriction, but we need to convert that bronchoconstriction into bronchodilation so that patient could be relieved. So for that purpose we are going to be talking about sympathomimetic drugs which actually have bronchodilatory action on the bronchial smooth muscles. So now if we talk about the short acting selective beta agonist of sympathomimetic drugs, these are actually more potent than that of long acting, and for this reason they are actually used for acute attacks of asthma. When emergency condition occurs, there is requirement of instant bronchodilation. So for that purpose, we often give such agents which can produce potent bronchodilation to recover the patient from that condition. And these are the most useful drugs to relieve bronchospasm. Inhaled adrenergic agonists with beta 2 activity are the drug of choice for mild asthma, that is in patients showing only occasional or intermittent symptoms. So, in mild, occasional, and intermittent symptoms, we use these agents. As we know, selective beta agonists are those agents which have only beta 2 activity. So, only beta 2 agonists are further divided into short and long acting. So, beta 2 agonist. So, now if we talk about the mechanism of action of agents, that is selective beta 2 agonist, so what happened that actually there is presence of beta 2 receptors over the bronchial smooth muscle cells. So when these receptors are being activated by any of the agent which we have talked previously, so when these agonists bind to the receptor site, there is cause of or stimulation of adenyl cyclase, which then result in cyclic AMP level being increased. As we know, this receptor is being coupled with GS protein, which then cause ATP conversion into cyclic AMP, and this cyclic AMP is very important as it play its role in relaxation of smooth muscle cell. So not only the relaxation of smooth muscle cell, it has a variety of other roles, such as cyclic AMP can decrease the release of inflammatory mediators which are involved in worsening the condition of inflammatory phenomena. Such mediators are cytokine, leukotrienes, and histamine, and various other. And the second one that we have talked previously, that cyclic AMP when being increased cause the relaxation of bronchial smooth muscle, which is being required in asthma. So the third point is this increase in cyclic AMP also cause decrease in secretions. In this way, it also helps the treatment of patient having asthma. So these are the three factors which are required for the treatment of patient having asthma. And all of these are being achieved because of increased level of cyclic AMP. So now if we talk specifically about short-acting selective beta agonists, so these are the agents which are given in inhalation route, and they are fast-acting bronchodilator with peak effect of short-acting. These have peak effect only in 10 minutes. And this action lasts for 6 hours. And these are most effective, convenient, and relatively safe bronchodilators. And short-acting beta 2 agonists have some adverse effects which include muscle tremors or nervousness, but these effects are minimum when they are taken through inhalation route, because you are now talking systemically these agents. So these are taken through inhalation route to avoid more of the adverse effect. So these are available in metered dose inhalers, nebulizers, or injection, and even in oral dosage form, which is rarely used. So now if we talk about long-acting selective beta 2 agonists, these are the agents which have duration of action up to 12 hours, and these are having is very slow onset of action, therefore they are not being used for acute attacks. So these agents are used for the prevention of nocturnal asthmatic attacks and for the maintenance of such attacks being happening. So these are used for long term purpose, but for acute or emergency condition we do not use these agents. And now if we talk about non-selective beta agonist, it includes adrenaline, which has alpha and beta activity, non-selective activity actually, and it showed rapid bronchodilatory effect. And next agent, that is ephedrine, it also has activity on alpha as well as on CNS, but it has slow mild bronchodilatory effect. So the next agent is isoprenaline, which also has non-selective beta activity, but it do not have any of the alpha activity. So this agent is also having rapid as well as marked bronchodilatory activity. Out of these agents, if we talk about adrenaline and isoprenaline, these also have rapid and marked bronchodilatory effect, but we do not use these agents more often, because these are having some adverse effects which cause their limitation, such as tremors, anxiety, restlessness. All of these adverse effects cause the limitation of these agents, and their non-selective behavior is not much appreciated. So this is all about the sympathomimetic drugs which are being used in the treatment of asthma. If you have any question, let me know in the comment section below. And thank you for watching my videos.